response with HBOT alone. Some success stories about flap necrosis. This 54-year-old man with buccal mucosa malignancy, and he had undergone surgery as well as radiation earlier. And then the mandibular plate got exposed after about 9 months, and he underwent a surgery for removal of that mandibular plate. Excuse me. And after that, the flap necrosed, as you can see here in these pictures. And serially, they debrided. And after about 25 days of trying everything, they referred the patient to me for HBOT. And you can see how bad towards the right of the wound, you can see how bad the wound was despite regular dressings and irrigations and everything else that they tried. So after giving about 20 dives of HBOT, you can see good, healthy granulation tissue. And then finally, the patient underwent a redo flap surgery and is doing quite well. Everything is healed. You can see the skin, the neighboring skin also. It shows a huge difference. Some part of it has been removed probably in the next surgery, but you can look at the neck skin and the cheek and all the surrounding skin. And he totally took about 48 sessions. He had a very difficult phase, but he managed it and he pulled through. He's doing well. Another 49-year-old patient with multiple, recurrences in the oral cavity, and he underwent a huge surgery with maxillectomy, mandibulectomy, and everything, and they put a flap and it necrosed. So they took him up for re-exploration, they put another flap and it necrosed. So after about 32 days of trying all this, this is the situation when this patient was referred to me. Of course, he had a tracheostomy. If you can see very closely in the right-hand side picture, you can actually see the Ryle's tube. So he also had a pharyngeal fistula. And we started him on HBOT and nothing else, just supportive care and HBOT. You can still see the Ryle's tube on the left-hand side picture, top left corner of the wound. And gradually, everything healed after just about 20 dives. I think this is really remarkable. And he's also doing well, and he's luckily disease-free as well. And even the pharyngeal fistula has healed. Another lady, 52-year-old, she was diabetic on top and she had a leiomyosarcoma of the back. She'd undergone surgery and radiation. And then she had developed a radiation ulcer. So they did some rotation advancement flap and that necrosed. So almost after 50 days of trying everything, she was miserable. She was undergoing regular dressings with a lot of debridements, and she was having fever. She was requiring a lot of high, strong antibiotics, very expensive. She was admitted in the hospital for these 50 days. And that's when they referred to me, and we started her on HBOT, and you can see what a remarkable change in the wound. Just about 17 dives. Unluckily, we lost her to disease progression because she already had lung mets, and but her wound was so much more better. Her antibiotics were stopped, and she was able to go home. Another 64-year-old man with multiple primaries in the head and neck region, and previous flap and another flap, and you can see the free fibula flap has necrosed so badly. You can actually see the entire free fibula which has been grafted there. Previously, the whole flap has come off. And this again happened after a plate removal. So any dental procedure, plate removal in previously irradiated patients, those are the usual triggers for flap necrosis. So this man was referred early because of our previous experiences, good experiences by the plastic surgery team. And subsequently, after 20 dives, he underwent a redo rotation flaps, and we actually again bridged him. We gave some 11 dives and did the surgery, and again gave another 9 dives. And actually, he's actually reading a newspaper in the left side picture. Although appearance is not that appealing, but at least he was able to go home and he had a functional chin. Another lady around 47 years old, again buccal mucosa. Soon after, she had very bad radiation skin burns. You can see it in the top left picture, and she had developed a orocutaneous fistula. So she was started early by the radiation oncologist. She was referred for HBOT very early, in fact, 48 hours after the radiation was over. And in 5 or 6 dives, you can see her skin, the radiation burns have healed so beautifully in the lower left corner. That's just about after 6 dives. And after this, the fistula was still persisting, so we gave her complete, I think she took only about 11 dives because she had some middle ear complications. She had otitis media, so she discontinued. But just with that those 11 dives of HBOT, you can see in these follow-up pictures that the fistula has completely healed and her skin is almost normal. It's just like the other side. There are no changes. Another 74-year-old lady with recurrent CA tongue. You can see the reconstructed tongue over there. And she had OR in both mandibles after a gap of almost 12 years. Uh, Quite miserable. The lady couldn't eat anything. She had so much pain and she had foul smell from the mouth. You can see those ulcers in the top left picture. And so again, we gave her the sandwich therapy. We gave 15 dives of HBOT followed by sequestrectomy and then another 15 dives and everything healed beautifully.